everyone, today we're going to talk about breast augmentation. Do you have a small chest compared to your friends? Does this cause you embarrassment and do you want to look more sexy or attractive? Well, this video is very suitable for you. You need breast augmentation, which can be done in several ways. Breast augmentation, also known as augmentation mammoplasty, is a surgery to enhance breast size. After watching this video, you'll be able to understand everything related to breast augmentation, the reason for resulting to it, how it can be done, and the expected result after the operation. Our role today is to answer most of your questions regarding breast augmentation. Today we have Dr. Seul, who is a leading doctor at JW Plastic Surgery. He's going to discuss with us everything about breast augmentation from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so the next time you'll be updated with our new releases. So, Dr. Seul, can you introduce yourself to our audience?
Hello, I'm Seul Cha Wong, Director of JW Plastic Surgery.
So we are here with some breast surgery questions. So how long does an implant usually last? And do you recommend patients to replace their breast implant at some time?
The implant does not have a fixed lifespan, so it is not necessary to replace it periodically. If there is no decisive problem, such as rupture, you can use it for life. In the past, implants used to rupture after more than 10 years of use, but implants used these days are durable and do not rupture easily.
So what should client do when the implant accidentally break open?
If the patient is suspected of rupture of the implant, she should undergo ultrasound and MRI at the hospital, and the doctor checks the implant rupture. If a rupture is diagnosed, the patient must undergo replacement surgery with a new implant. The ruptured implant is removed through the existing incised line, and a new implant is inserted. And if the film surrounding the implant is in poor condition, the film is removed together.
So how to choose the best implant that suits your client?
When determining the size of the implant the patient wants, I put the implant inside the bra and measure the size of the implant the patient wants, and measure the chest width of the patient to find out the diameter of the implant that fits the patient. With that diameter, such implants of the size the patient wants as candidates. Sit the operating table upright during surgery, check with a measuring tool, and find the size that suits the patient's body best, and that the patient would look like. When the patient makes a final decision, insert implants of the specification. There are several brands of the prostheses, such as Rotiva, Sieben, and each product has its pros and cons. So doctors decide the brand after sufficient consultation with the patients.
So what are the main incision types during the breast augmentation?
The incision for breast augmentation includes an armpit incision, an areola incision, a breast underline incision, and a belly button incision. An areola incision and a belly button incision are not used because of several drawbacks. Armpit incision and breast underline incision are performed the most. In the case of armpit incision, the chest is very small, so it is usually performed on unmarried women with a light underline. This surgery has the advantage of being able to hide scars and armpit wrinkles and not leaving many scars. Another incision has the advantage of fast recovery and advantages for correcting sagging or contracting breasts. When applied to people with deep underlying or childbirth experience, there are few scars left.
So, Dr. Seul, what is actually HD endoscopic breast augmentation and what is the benefit of it?
In the case of the breast underlying incision method, the incision is close to the chest, so when the chest is illuminated with light, the inside of the chest is visible to the naked eye, so accurate surgery is possible without an endoscope. However, armpit incisions cannot be seen as lighting inside the chest because the incision is far from the chest. Therefore, a long metal tool is placed in the chest and stirred to make an implant. But the disadvantage is that the measurement is not accurate. The hemostasis is difficult. and pain is severe. However, if you perform surgery using a full HD endoscope, you can see the inside of the chest with a high-resolution endoscope and peel off with a high-frequency device, so the surgery is accurate. There is little bleeding, less pain, and fast recovery.
So can you tell us more about the combination breast augmentation at your clinic?
Combination breast augmentation is a surgery method of JW plastic surgery that uses both implants and fat transplants. Because implants are artificial materials and are different from human breast tissue, the chest does not look natural after surgery if the patient's physical condition is poor. However, if we perform a combination of fat transplants, patients can get natural results. If the breast tissue is very thin, the thoracic shape is not good, the contracted chest is severely asymmetrical, and the breastbone area is wide.
Okay, so how much fat can be absorbed after the fat grafting?
About 50% of the implanted fat is missing, and the remaining 50% is absorbed over about 3 months. The fat that is completely attached remains the same as the original breast fat. The deposition rate varies from person to person, and PRP and FEF stem cells are sometimes injected together to increase the deposition rate.
That's it for today.
Thank you.
So we learned many things about breast augmentation, and the doctor explained in details everything related to this cosmetic procedure, such as how it can be done and the best candidate for it. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and respond to you as soon as we can.